My name is Anita Gerber. I'm a licensed clinical social worker. I also have done advanced training in family therapy through a program at University of Chicago. I've been in practice around 40 years, and I have an office in Glenview. I have a lot of experience in treating families. As I said, I did an advanced program in working with families, so I see a lot of families who are in conflict and where there's distance between family members. Also, which would probably naturally follow, people and families who are in transition, people who are dealing with marital separation, divorce, launching kids to college, helping aging parents, job loss, depression and anxiety, and illness, disease, and loss and grief would be the areas probably that I most prominently see people in. I see people from a strengths perspective, and that would mean that people have many levels of resilience and coping skills, and not pathologizing people, seeing people, individuals, as having problems, but not being defined by their problems and being bigger than their problems. There isn't anybody who walks through life who doesn't have challenges, and it's been my experience that a therapeutic relationship can often help people tap into their strengths and move them through the challenges that they're facing. Hopefully I would characterize myself as somebody who's empathetic, supportive, and open to listening, and respectful of clients. I realize that when people come to see me that there's kind of a leap of faith that I'm going to understand them, that I'm going to understand the problems that they bring to the table, and that I'm going to be respectful of them. I'm hoping that I hope that my many years of experience also has given me the wisdom to be empathetic and aware. This is an interesting question. I don't think that there's any one right way, and I don't think that there's any one right way. I think that it's very important for a client to be clear as to what they're looking for when they meet a therapist or when they interview a therapist, and to come with many questions. And in today's world, most therapists have websites, to check their websites or professional directories, and to consult with other professionals or other people who have been clients about what their experience has been in therapy. I think that it's difficult when one is looking for a therapist because most people are feeling vulnerable at that point, and sometimes have difficulty trusting their judgment. That would be a pitfall, I guess, is having confidence in what you know to be true and who you know that will make you feel comfortable or will understand you. So I guess the pitfall would be not letting your vulnerability get in the way of trusting your sense of what you know. Obviously, or seemingly obviously, respect for the individual. That's kind of like at the bottom of the pyramid or bottom of the triangle. Also, the old social work axiom to start where your client is and to know where your client is. And also to know what you know, to be aware of what you know, and maybe even more importantly, to know what you don't know as a therapist and as a person. And to be kind and compassionate, and to treat a client as you would wish somebody would treat you.